We are just from the Kenya Health Summit, and we ended great conversations that were presided by the President of Kenya, William Ruto. And I have a few reflections to share with us. And first of all, just to mention that Kenya is at the precipice of making huge milestones in the arena of health. We have seen 4 major reforms take place in the last 2 years that have unlocked health financing through Social Health Authority, through Facility Improvement Financing, through Primary Healthcare, and the Digital Health Act. Just to lay the foundation of my submissions and reflections to you, we are aware that countries like the US and the European countries invest over $10,000, $8,000 per capita on the health of their people. Whereas in Kenya, we're investing close to $100, $150 per capita. That is a huge difference. So even if we were to meet the Abuja Declaration of 15% of the national budget, we shall still not achieve our goals as we want as far as health financing is concerned. Many of the conversations within the town hall were very good, and we have seen that SHA is working many ways. But even if we get 15% of our 4.8 trillion or 5 trillion of our financial budget in this fiscal year, we shall still be complaining of the same problems. And if we shall have another health summit next year, we shall still come back to talk about SHA and all the challenges that our Kenyan people are facing with regards to payment of hospital bills. So what do we need to do differently? We need to embrace social determinants of health. We need to embrace prevention and preventive financing. What do I mean? $1 invested in public health, in community health, has a return on investment by $10. $1 invested in primary health care returns $16. So we need to change our mindsets and look at how we can finance prevention. Well, they say prevention is better than cure, but how do we do it? As we look to going towards Vision 2030, as a country, we are supposed to invest in climate health, mental health, and those are not tangible things. So it is upon our government and our stakeholders in this country to start talking about having public health units, community health units as spending units. Can SHA purchase services at level 1? Can SHA purchase the services of public health officers? We have a double tragedy. Communicable diseases are rising the same way as non-communicable diseases. Dr. Gidinji challenged us, and I think that was the best part of the conversation towards the end of the town hall meeting today, when he said that we need to build the health architecture. We need to think about health and not necessarily diseases. So this is my call to action for all of us. Let us invest in prevention. Let us prevent preventable deaths. Let us have the community health units, the public health departments, do more public health surveillance, do more early health seeking behavior change through the community health promoters, the public health officers, so that we can have more money going to prevention. I would like to say something else that is important. As much as we hope that SHA will start purchasing these services, that does not mean that we should start now reducing the money that is already set aside by the national exchequer. For instance, the county governments have 30% of their money going to health. And when you talk to NCEC in the ministries, in the county governments, they'll tell you that of all the monies they get, a third of that money goes to the health docket in the counties. Whereas the other departments, such as agriculture and other devolved services, just for the other 2/3. So if we are to embrace social determinants of health, then we need to ask ourselves, where do we get the rest of the money? So that boils down to how much money goes to health. If we want to position health as an investment, like education is an investment. We are committing 767 billion to education, whereas we are only committing 177 billion to health. And even if we assume that every county in Kenya would put 30% of their budget to health, that totals to around 154 billion in total going to health. That gives us around 300 billion. So if you were to have an artificial comparison between education and health, then you find we are looking at education as an investment and still looking at health as an expenditure. And that's why everybody wants to see SHA chasing every bill. The president was at loss today, where everybody wants every single problem to be solved by SHA. We need to start thinking beyond SHA. As much as SHA should be optimized to buy services at level 1 and public health, we also need to look at, can the Ministry of Agriculture, Security, and other line ministries start working together to think of Vision 2030 and beyond. Let us embrace the social determinants of health. Can you imagine one day when we have reduced all cancers, reduced all challenges that bedevil the people of Kenya, and then that money will start to be used to fix our roads, to fix our economy, and not just to fix health. So that is a vision I see beyond 2030. Are we ready to do that? Because remember, we are not yet where other countries are, but we need to embrace universal health coverage and having pragmatic budgets that can unlock the potential of Kenyans. I would like to end by saying the national government keeps 90% of the national cake and 10% goes to the county governments. So 500 billion was assigned to the county governments by the national government, and 500 billion out of 4.8 trillion is more or less like 10% of the national cake. So it is upon us to start thinking of how can we increase the money that goes into the devolved governments so that they can give more money to service delivery, because the 30% that goes to health in the county pays salaries and infrastructure. But if you are to do disease surveillance, dialogue days, action days, behavior change, mindset change, then we need more money to go into that part of the health system, not just brick and mortar, but changing the mindset, investing in what people cannot see, not just brick and mortar, but changing mindset. So that's where the money needs to start going. Those are the social determinants of health we're talking about, changing the minds of our leaders and Kenyans. For Kenyans to look at SHA not as paying for diseases, but to look at SHA as a conduit for paying for health promotion, health checkups. When was the last time were you checked on your diabetes, sugars, hypertension? We need to embrace preventive care, prevention, social determinants of health, because it is not just about the Ministry of Diseases, it is the Ministry of Health. We have moved from the National Hospital Insurance Fund, we have socialized the health system to now talk about the Social Health Authority, Social Health Insurance. Let us socialize the ecosystem. Let us demedicalize. Let us democratize the access of health services to all Kenyans as we move towards Vision 2030. Let us look at health as an investment and not an expenditure. So those are my reflections, and we've been challenged by the President to think about what do we see in Vision 2030 and beyond. Mental health, climate health. We need to look at food safety, regulations, and let us reduce the needless deaths of women and children. Every woman, every newborn, everywhere counts. 70% of those deaths can be prevented. And let us also think of creative ways, like earmarking taxes. Not increasing taxes. I know Kenyans might be very concerned about that. I'm not saying we increase taxes, but we earmark certain levies to go to the primary health care fund. And then ring fence that money at the lower levels. Let us think of creative ways of bringing more money into health. See you soon. Let's keep this conversation going, and as we move to the Kenya Public Health International Conference, let us think of how we can elevate the conversations on prevention, because the return on investment is higher. Let us think together. We are not fighting. Public health, community health, doctors, nurses should all work towards one goal, because we're not fighting against human beings, against cadres. We are fighting against viruses, against cancer, against bacteria, against fungi, and other microbial substances out there. Keep it here, keep it locked.